Welcome to Med-Surg Tutor. Today we'll be going over some practice questions for vital signs. Let's go ahead and begin. First question. A nurse is assessing a post-operative patient's vital signs. The patient's blood pressure is 124/72. Heart rate is 94 and respiratory rate is 18. The patient is alert and oriented but has a decreased oxygen saturation of 88%. What should the nurse do next? A. Increase the oxygen flow rate and notify the healthcare provider. B. Recheck the oxygen saturation in 30 minutes. C. Administer a bronchodilator as prescribed for the low oxygen saturation. Or D. Continue to monitor the patient as oxygen saturation can fluctuate postoperatively. Now you guys can pause this video as we progress through going through the questions, but I'm just going to go ahead and dissect the question. So here they give us the patient's vital signs. The first thing we want to do is look for what's abnormal. And as we can see, the oxygen saturation is abnormal. So what we want to do here, B is recheck the oxygen saturation in 30 minutes. So that kind of delays care. So we don't want to go with that answer. C, administer a bronchodilator as prescribed. That doesn't really resonate with what the patient needs right now. D, continue to monitor the patient. Well, if you see the oxygen saturation for the patient is 88% and you just decide to monitor instead of actually taking action, you put in a patient at risk. So I would say the answer is A. So the answer is A, increase the oxygen flow rate and notify the healthcare provider. So in this case, we don't want to wait to take action if we know that the patient's O2 levels are 88%. That is not a normal vital sign. So we need to know our vital signs to know what to look for and know what to act on. Question 2. A patient has sepsis. A patient with sepsis has a heart rate of 110, respiratory rate of 22, and blood pressure of 95/60. What is the nurse's priority action? So already we want to look at what's out of range. Respiratory rate seems a little elevated, nothing crazy, just a little elevated. Heart rate, we want it from 60 to 100, so that's a little elevated, and blood pressure is low. Let's read our options. Administer IV fluids as prescribed to restore circulating volume. B, administer antibiotics as prescribed to treat the infection. C, monitor the patient's vital signs every 15 minutes. And D, place the patient in the lateral position to optimize oxygenation. Sorry, guys. So obviously the answer is not going to be C, because if we see the blood pressure is 95/60, that's what we're worried about, because one, it puts the patient at risk for falling, hypotension, orthostatic hypotension, and that's not addressing the problem right now. B, why would we administer antibiotics when this patient, it doesn't say anything about him having a infection? So we don't want to give more to the question than that's provided to us. So, and D, we don't want to put the patient in the lateral position. If anything, we want to put them in a high Fowler's position. So here the answer is going to be A, administer IV fluids as prescribed to restore circulating volume. When we give the patient that IV fluids, that's going to drive that blood pressure back up. Question 3, in a patient with a history of chronic obstructive pulmonary disease, which vital sign change is most concerning for acute exacerbation? So here you guys need to know what to expect with a patient with COPD. So first we have A, increased heart rate and decreased respiratory rate. B, decreased oxygen saturation and increased respiratory rate. Or C, increased blood pressure and decreased heart rate. Or D, increased blood sugar and decreased blood pressure. So automatically we're going to get rid of D, because this doesn't really, blood sugar isn't even a vital sign. And the question asks what vital sign change. So they're asking about vital signs. Here the answer is going to be B, decreased oxygen saturation and increased respiratory rate. Remember, our patient with COPD, they're going to have issues with breathing, and them getting oxygen is going to be a priority. And their increased respiratory rate is a signal that they're struggling to get that oxygen, especially if their oxygen saturation is low. Question 4. A nurse is caring for a patient who is recovering from a stroke. The patient has difficulty swallowing. Which of the following actions should the nurse take to prevent aspiration? So we have A, position the patient in a high Fowler's position while eating. B, encourage the patient to eat quickly to reduce the risk of aspiration. C, offer the patient a thin liquid diet to promote swallowing. Or D, use a nasogastric tube for all feeding and hydration. So here we need to know what we can do as nurses, right? Offer the patient a thin liquid diet to promote swallowing. That's probably not even in our scope of practice, because usually it's the physicians who dictate what type of diet that the patient is going to be on. B, encourage the patient to eat quickly to reduce the risk of aspiration. Well, think about it. If you eat quickly, you're just forcing that food quickly, down your throat. That's actually going to increase your risk for aspiration, not decrease it. And D, use a nasogastric tube for all feeding and hydration. So the question asks prevent aspiration, right? So D is kind of irrelevant, especially for the fact that, we don't know if this patient even has an NG tube present. So obviously the answer here is going to be A, position the patient in high Fowler's position while eating. This is so that when they're laying down, more than likely they're going to struggle to swallow that food, but when they're sitting up, they can take that food down more easily because they're sitting up. So the risk of them aspirating is going to be lowered. Question 5. A patient with COPD is unable to perform personal hygiene without becoming exhausted. What nursing intervention will be appropriate for this patient? A, assisting with all bathing and hygiene. B, telling the patient to avoid speaking during hygiene. C, teaching the patient to take short, shallow breaths during activity. Or D, taking rest periods between activities. Okay, so here we want the patient to be involved in their care. We're all for that. If the patient can be involved with their care as much as they're able to, we advocate for that. We want them to be a part of, the whole plan of them getting better. So assisting with all bathing and hygiene takes that away because we're doing everything for them. We're not allowing them to participate in their own care. B, telling the patient to avoid speaking during hygiene, that's irrelevant. C, teaching the patient to take short, shallow breaths during activities. That's not really going to help the patient if they obviously are getting exhausted, right? So the answer here is going to be D, taking rest periods between activities. Remember, this patient has COPD. They're already struggling to breathe. So if they need a break, give them a break. You don't have to do all the hygiene care for them. If they're able to and willing to participate in their own care, as a nurse, you should let them do that. Question 6. A nurse is assessing a client's blood pressure. Which of the following actions should the nurse take to ensure accurate measurement? A, inflate the cuff rapidly to 220. B, ensure the client's arm is above heart level during the measurement. C, use a cuff that fits the client's arm size appropriately. Or D, position the client lying flat on their back. So here we need to know the actual steps of how to take blood pressure. So if you know this, then you already know that C is the answer. Use a cuff that fits the client's arm size properly. We don't want to inflate the cuff too much. That could give us an inaccurate reading. We don't want to raise the client's arm above heart level because that could give us an incorrect reading. And we certainly don't want them lying flat on their back. Usually we want them sitting up with their legs uncrossed. So make sure you guys go over how to take blood pressure and what you want to be mindful of. Question 7. The nurse is taking the blood pressure of a client who is anxious. Which of the following actions should the nurse take to improve the accuracy of the reading? A, ask the client to take slow, deep breaths while measuring blood pressure. B, measure the blood pressure immediately after the client reports anxiety. C, inflate the cuff 30 above the usual systolic reading. Or D, perform the measurement after the client has been sitting quietly for at least 10 minutes. So remember the last question, we want to think about the things that can give us an inaccurate reading of blood pressure, right? So why would we want to take the blood pressure right after they express they have anxiety? So B is definitely out of the question. And the question is asking improve accuracy. And the question is saying the patient has anxiety. So here the answer is going to be D. The answer is going to be D because once the patient is sitting quietly for at least 10 minutes, they have that opportunity for their anxiety to go down, meaning that their blood pressure won't be elevated and give us that false reading. Question 8. The nurse is assessing a client's radial pulse. Which of the following actions should the nurse take if the pulse is irregular? A. Count the pulse for 30 seconds and multiply by 2. B. Use a Doppler ultrasound to assess the pulse. C. Count the pulse for 1 full minute. Or D. Document the irregularity and continue assessment. All right, guys, so we obviously see that this vital sign is irregular. It's not within normal limits, right? So why would we just document? Usually when we see something that's abnormal, we want to do something about it. So first, obviously, you're going to want to assess more, or depending on the situation, you're either going to want to assess more or go ahead and act. In this case, we're going to want to count the pulse for 1 full minute. This is so we can hear the what's irregular about the pulse, really. So A, you do for a normal client, just count 30 seconds and multiply by 2. But C allows us to really listen to that radial pulse. So that's relevant to the question. So when you're answering these questions, some of it is having the knowledge, and then the rest of it is knowing what the question is asking you and applying those critical thinking skills, right? Question 9. A nurse is taking a client's blood pressure and gets a reading of 160/90. The nurse recognized that this value falls under which classification? A, normal, B, elevated, C, stage 1 hypertension, or D, stage 2 hypertension. So here, this is kind of a knowledge question. The answer is going to be stage 2 hypertension, D. And you guys, it's important to know stage 1, stage 2, and what the parameters are. So for stage 1, you're looking at 130 to 139, and then stage 2 is anything above 140. Question 10. The nurse is caring for a client with hypotension. The client is reporting dizziness. What is the nurse's priority action? A, administer the prescribed antihypertensive medication. B, encourage the patient to sit up slowly and dangle their feet. C, take the client's blood pressure again in 5 minutes. Or D, notify the healthcare provider of the dizziness. Okay, let's analyze this question. So we know this person has hypotension. A is telling us to administer the prescribed antihypertensive medications. Well, if they're hypotensive, why would we want to give them antihypertensive medication? That's just going to drive their blood pressure even lower. B, encourage the client to sit up slowly and dangle their feet. Yes. So sometimes you need to understand what the question is asking you. This question is sort of a safety question because when a patient has hypotension, they're at a risk for falls because if they stand up too quickly, they can get dizzy and fall. Here it says the client is actually dizzy. So as soon as we see those red flags, we should know that this is a safety question. By letting the client sit on the edge of the bed and dangle their feet, it's giving them a minute for their blood pressure to stabilize. And so before they get up, they don't have that dizziness. So the answer here is going to be B. But let's look at the last two. C, take the client's blood pressure again in 5 minutes. Remember what I said, guys. You do not want to wait when something is abnormal. You want to either assess, but in this case, you wouldn't do that because this comes down to safety. So when it comes down to safety, more than likely you're going to want to act. And D, notify the healthcare provider of the dizziness. Well, this is irrelevant, and the healthcare provider is probably going to look at you like you're crazy because this is definitely something that the nurse can handle. 11. A nurse is assessing the client's respiratory rate. Which of the following is considered a normal respiratory rate for a healthy adult at rest? So I'm not going to go too deep into this question because you guys should know the range is 12 to 20. So the answer here would be B. So guys, make sure you know your normal ranges for the vital signs. And know this is important because once you know those normal ranges, you know what a red flag looks like. You know when something is not within normal limits. 12. The nurse is caring for a client with an elevated blood pressure reading of 160 over 100. What should the nurse do next? A. Repeat the blood pressure measurement after 5 minutes. B. Notify the healthcare provider about the high reading. C. Provide the client with a warm blanket to reduce stress. Or D. Document the findings and continue with other assessments. Like I said before, we want to address this problem now. So giving them a warm blanket to reduce stress, that's irrelevant to the question. Document the findings and continue with other assessment. That's irrelevant right now because we want to either act or assess, not document. Document is usually the last thing you want to do. So we have A and B. Repeat the blood pressure measurement after 5 minutes. Now, most of you might want to go with this answer, but the answer is actually B. Notify the healthcare provider about the high reading. Guys, this is stage 2 hypertension. This is important. Plus, guess what? We don't know this patient's baseline vitals. If we don't know this patient's baseline vitals, then a 160 over 100 is a red flag to us. So this is what we're going to go with. Now, if the question said something like a patient who's hypertensive has this reading, that 160 may be normal for the patient, right? But they didn't give that to us in the question, right? So we're going to take what we know, what they gave us to answer the question. Question 13. A nurse is performing an assessment on a client who has a heart rate of 50 beats per minute and is asymptomatic. What should the nurse do next? A. Administer a beta blocker medication. B. Continue to monitor the client and observe for symptoms. C. Document the heart rate as abnormal and notify the healthcare provider. Or D. Perform a 12-lead ECG to assess for underlying issues. All right, guys, a little teaching moment here. So the client has a 50 beats per minute heart rate and they're asymptomatic. So we don't want to give them a beta blocker, but what we are going to do is continue to monitor the client and observe his symptoms. So some clients are athletes or they work out. So if they work out or they're athletes, their heart rate might be lower because their heart is quote unquote healthy. So they don't need to, their heart doesn't need to work as hard to, give them that blood around their body, right? And then it says they're asymptomatic, meaning, this patient is alert. They're not showing any signs of distress and anything, but the heart rate still is low. So we want to monitor the client and observe for symptoms. And if you do have a patient like this, you might want to ask questions like, do you work out? Are you an athlete? Things of that nature. Question 14. The nurse is assessing the client's oxygen saturation using a pulse oximeter. The client is wearing bright red nail polish. What should the nurse do next? A. Continue the assessment and document the findings. B. Remove the nail polish to ensure accurate reading. C. Use a different method to access oxygen saturation, such as arterial blood gas. Or D. Apply the pulse oximeter on the earlobe instead of the finger. So the answer is not going to be D because we don't get the O2 by putting the pulse oximeter on the lobe. We do it by putting on the finger. So make sure you review how to take each and every vital sign. C. Use a different method to assess oxygen saturation, such as arterial blood gas. As a nurse, some hospitals may require you to, be certified to do this, or they'll actually have a team to do arterial blood gas. So this isn't really in the scope of practice for the nurse. B. Remove the nail polish to ensure accurate reading. This is going to be the question. This is going to be the answer. And this question kind of just shows you that you know what to look for when you're taking vital signs. If you see your patient has nail polish on, that's going to affect their O2 stats. That's going to give you a wrong reading. That's going to throw up red flags. So make sure you remove that nail polish. A. Continue the assessment and document findings. Well, if you continue the assessment, you're going to have a wrong O2 stat reported. So that's going to be inaccurate. Question 15, the final question, guys. The nurse notes that the patient is using accessory muscles to breathe and has a decreased level of consciousness. The nurse is concerned about possible hypoxemia. What is the priority action for the nurse to take? A, administer supplemental oxygen and reassess oxygen saturation. B, increase the patient's IV fluids to improve circulation. C, obtain a chest x-ray to assess for pneumonia. D, document findings and continue monitoring. So if you guys have been listening to anything in this video, you know that D is not the answer because document is the last thing we want to do. You know, C is not the answer because they're having a decreased level of consciousness and possible hypoxemia. What is a chest x-ray going to do for us to assess for pneumonia? The patient might be dead by the time we come back to check up on them. B, increase the patient's IV fluids to improve circulations. Pay attention to the question. They're using accessory muscles to breathe. This isn't really a problem with circulation. It's a problem with their breathing. A is going to be our answer. Administer supplemental oxygen and reassess oxygen saturation. So this is the question paints the picture of this is a breathing problem, and A resonates with this. And it also includes reassess oxygen saturation. So not only are we implementing nursing interventions, but we're also using the nursing diagnosis by reassessing and seeing if what we did worked. All right, guys, that's it for this video. I may be dropping a part 2. Happy studying.